webinar, Telemental Health Best Practices Overview. Before we begin, I'd like to make sure everyone can hear me okay, so please just type the word yes into the question box if you can hear me. Great. Each attendee is in listen-only mode to avoid having background noises that may distract you from listening to the webinar. We will have a question and answer portion at the end of the presentation, and throughout the presentation, a staff member will be managing the chat and question box on your GoToWebinar control panel. If you have any questions during the presentation, please type them into the question box and we'll answer them for you. OMCA is an approved continuing education provider for the National Board for Certified Counselors and the Ohio Counselor, Social Worker, and Marriage and Family Therapist Board. This webinar is 1 hour long and therefore attendees will receive 1 continuing education credit. In order to receive your credit, you must be on the call for 45 minutes or longer. All attendees will receive a recording of this event and a CE certificate will be made available to those who attend for 45 minutes or longer. Each of these materials are emailed to you within 5 business days after the webinar. If you have any problems or questions about your CE, the recording, or the follow-up email, please reach out to us at education@omca.org. This webinar will also be posted online at omca.org for our members to view at any time. If you've not already explored the OMCA webinar archives or are not aware of our home study offerings, please check them out on our website, www.omca.org. Before we begin, I'd like to share with you a statement from our insurance partner, CPH & Associates. As the endorsed professional liability insurance for OMCA members, CPH & Associates is pleased to assure you that we cover services provided via telehealth so long as your services are permitted under your state's law. There is no rider or additional coverage you need to add to be covered for telehealth. In addition, your professional liability is portable coverage, which will allow you to follow you wherever you are legally able to provide services within the U.S. Whether you're doing telehealth from home, seeing your clients in office, or doing walk and talk sessions, your policy will cover you for these services. Please don't hesitate to contact us if you have any questions. And without further ado, I'll turn it over to you, Joel.
Thank you, Rebecca. I hope everybody is doing well on the call here today, given the circumstances. I know that we're in very uncertain times and fluid times, but just wanted to say thank you for all those who are attending the call today, for all you do, knowing that you're on the front lines as primary mental health providers and providing support for the health and safety and well-being of people with mental health conditions. And, we're obviously, the OMCA team is very proud to be working for you, knowing, during this crisis that you're on the front lines providing critically important treatments and services to vulnerable Americans who suffer from mental health conditions. If you have not had an opportunity to visit, our website, please see, go to www.omca.org for several resources that we've been trying to post related to the COVID-19 crisis, and we've identified several resources related to telemental health. And with that in mind, I am, very pleased and grateful to have with us today, Ray Barrett. As many of you know, I think Ray is the founder and chief executive officer of the Telehealth Certification Institute, and he's really a well-known expert and telemental health consultant and instructor, and he has assisted many organizations with creating and launching and enhancing their telehealth programs, has developed several courses on telemental health and provided speaking engagements nationwide. And as a clinician, Ray has extensively provided telemental health counseling services in private practice and for various facilities. So with that in mind, I'm going to turn the program over to Ray.
Thanks a lot, Joel. And hi, everybody. Glad you're here and that I'm able to be here with you. And I echo what Joel said. I really hope that you all are doing well. And if you know of anyone or if you are not, I hope you get well soon. This is certainly interesting times, and the world is in a crisis because of COVID-19 at this moment, which has probably brought a lot of you here because you're kind of put in a position where you have to provide services remotely to your clients. Just to get a sense of where people are with telemental health, Rebecca, if you could put out the first poll, wondering if you're currently providing teletherapy, and you could just answer the poll on your screen. Let's see. So looks like I have the poll. Is the poll up yet, Rebecca?
Yes, the poll is up. We're
Oh.
collecting the responses right now. There you go.
All right. So do we have the poll results?
Yes, they are up on the screen. It was 76% was yes, 24% said no.
Oh, okay, great. Yeah, so that's quite a lot. So if we did that poll maybe even a couple months ago, it'd be a whole lot less, I'm sure. Things have definitely shifted. And for some people, they want to do telehealth, and they've been doing it for a while. For a lot of clinicians, they have to. They're forced into it. So there's really a parallel process between what a lot of clinicians, maybe yourself, are going through, and clients who are being kind of forced into receiving and providing services virtually. So there's that kind of universal thing that we're going through, and when meeting with clients, kind of speaking to that will help normalize things. So there's telemental health, just to define it. First, let's define the word telehealth, which is a broad term. Telehealth encompasses a lot of things. You're receiving telehealth right now. It's healthcare education virtually from a distance. It's also providing consultation. It's providing care coordination and direct services to clients. So telemental health is very specifically providing mental health services to a client when you and the client are not in the same room as one another, right? So through our graduate program and supervisory work, most of us have been trained how to provide services when the client's sitting in the same room as us. Most of us have not been trained on how to do that when the client's not in the same room as us. However, technology has been around for a long time. People have been providing at least phone sessions for quite a while. So it's been around, but we just usually have not been trained on it unless we took a continuing education program. You all right now are very aware of the benefits of telemental health. I'm sure you could think of several clients that you have right now where it's been very beneficial because they can't come to your office because of the quarantine. And I would imagine that for most of you, it's worked out just fine. Now, being prepared for those things makes it work out a whole lot easier. But there's several other reasons. One thing I want to point out is globally, people are being quarantined because of COVID-19, which is requiring to connect with each other virtually. And because of that, there's been some policy changes, and the government's helping out in a lot of ways. But I want us to be aware that on the individual level, these issues come up all the time for people, and they're just as important on that individual level. Transportation issues, illnesses, several barriers to even receiving access, not having an appropriate clinician within their geographical region. And in terms of research, there's been a whole lot of research done on telemental health. One of the great resources that you have available to you in terms of looking at the extensive research and journals out there on telemental health is the telehealth resource centers. So the federal government actually has an agency just for advancing telehealth in our country. It's the Agency for the Advancement of Telehealth, and they fund 14 telehealth resource centers throughout our nation. And they have a whole list of all the research for telemental health, and you can search the particular thing that you're looking for. So across the board, for a long time, we've known that telemental health, according to research, is just as effective as if the client comes on site. So it's good that we're starting to see some changes in terms of reimbursement for those services. So not only are there benefits because of barriers, there's actually a lot of benefits for individuals. such as some people like to talk to their clinician where they're holding their phone right to their face, right? There's something really comforting, therapeutic about that. Some people process information just auditory much better without the visual distractions.
Here's the top search result.
Sorry, now my phone's talking to me because I touched it, right? We're connected. Yeah, so, and some people are too intimidated to go to a clinician's office. They're not going to be maybe as authentic, or they're maybe not going to disclose as much, or they might put on a facade or whatever it is. So that the technology actually has several benefits to it. We're going to be putting on a conference coming up soon that I'll briefly tell you about. It's a virtual conference, and there's so many benefits to it. You're able to find people like that rather than having to walk down the hall, right, and find the room that you're going to. There's actually a lot of engagement that's built in. So it's not that one is better than the other. It's not that on-site or off-site or video or phone or text-based it's not that one's better than the other. You probably heard about client-centered, right? So it's what is it that's a fit for the client and the clinician, right? It has to be a fit for the clinician too. But what's a fit for the client at that time, at that moment? That's going to be most therapeutic. That's what's important. Now, there are some drawbacks, right? There are some limitations. You can't touch the client. You can't smell them. You might not be able to see their entire body. You're not able to do toxicology screening on site. You don't have that same sense of presence as you do when you're in the same room as one another. And there are technology drawbacks. People can have inadequate bandwidth, internet speed. They can have really poor equipment. Just the quality of the video or phone call could be poor. They might not have access to the technology or internet service. Technology can go out. There can be interference in the internet. So there's a whole lot of technology issues that can go bad, right? There's also the privacy concerns. So you probably learned quite extensively about how to keep your session with your client private. There's no way to eliminate the risk of that. Someone can easily carry in a recording device, or one could be planted on them in their purse or in their jacket, right, during their session. So you're not going to wand them before they come in the office and stuff like that. But you know how to set up your space that's private and secure. You don't have that same kind of control when the client is in their location. So the education and training and preparation are important. So part of being competent in providing services, I call it same location services when the client's in your office, you have to learn how to do that appropriately, right? There's competencies that go along with that. And the same with providing services virtually. Okay, so then we have, in terms of privacy, there's also privacy laws in regard to patient information, healthcare information. In terms of privacy laws, we have federal laws that most of us are regulated by. That's HIPAA law. So we ought to certainly be keeping HIPAA into consideration. But this isn't new. If you are covered by HIPAA law, then you have to abide by HIPAA law whether you do telehealth or not. Doing telehealth actually has very little impact on your requirements for being HIPAA compliant. But because you are using the technology in practice, it is very important to be aware of HIPAA regulations. And the reason why is HIPAA is not this like thing to watch out for, right? Like Big Brother's just causing problems, right? It's actually there to serve us, because our clients come to see us because they trust us. They trust us to keep their private information confidential, right? Think of this. In terms of your use of technology, you probably know by now that there are risks to your private information, right? That someone can possibly intercept your information or hack your computer or hack servers that you utilize and gather your information. And that's a real risk. And there are ways that you can mitigate that. We've probably all heard of Edward Snowden, right? And he has his tactics that he implements, which a lot of people implement, to make sure that their information is secure. That takes a lot of study and implementation, takes some work, right? So some people are like, I'm not going to do that. I don't really care that much if people find out my information. But as a clinician, we are actually holding a lot of people's really personal, sensitive information and stories. So we have to be that much more careful. So we have HIPAA, and we also have state privacy laws within our state. You also have your licensure law, and you also have your code of ethics, and a lot of licensure laws require that you follow a particular code of ethics. So if we follow these regulations, we're actually going to do a very good job at protecting the privacy of our clients' information. A lot of people ask about the legal aspects of telemental health. You know, it's interesting to me. A lot of the questions that come about around telemental health is because people think that it's somehow separate or different than simply providing mental health services when a client comes into your office, right? Not much changes at all, okay? There are some things that change, which do require competencies, but not much, right? So people say, well, you know, they ask questions about the technology or what technology they can use or where they can practice. It's the same as if you were providing services in your office, right? In the United States of America, states have the authority to implement licensure law if they choose to do so. So a state can prohibit the provision of a certain service, professional service, if they want, or they could prohibit the use of a particular professional title if they want. They prohibit these things without authorization if someone doesn't have authorization from the state government to use them or to provide that service, right? That's licensure law. So in the United States, we have licensure law. You're very aware of licensure law, right? So because of that, yeah, clinicians can only, they cannot provide a service or use a professional title in a state that has licensure law that prohibits that particular service or title without being authorized. So some states do have provisions to allow clinicians who are licensed elsewhere to practice within their state for a limited amount of time within the calendar year. So it's important to understand those legalities and learn how to navigate them. There are some really good resources for that. I'll show you one of those. So you can, is my say video blocking the screen or no?
No, we can see both.
All right, so, you know, on our website, telementalhealthtraining.com, if you go to the resource tab and click on state rules and regulations, it lists out a lot of really good resources for you. So it has like an overview of the laws, then it has how to look up licensing board's contact information. Then it has privacy laws per state, a link for that, and breach notification laws per state, a link for that. Tarasoff laws by state has a link for that, age of consent to records and so forth. But more importantly, down below, we list all 50 states. So you can go to one of these states and see, you know, what are the regulations around telemental health for that state, for counselors, social workers, and so forth. You can see whether or not they have provisions to allow outside clinicians to practice within their state for a limited amount of time. Like the first state listed, Alabama, they actually have provisions for counselors to practice in their state for 30 days out of the calendar year. They might require, you know, notification or approval first. So state licensure law is complicated because there's so many different licensing boards throughout the United States. And you know, if you want to know for sure that you are practicing legally, that you're not violating, like say licensure law, you would want to know that the licensing board in the state where the client is during the time of the session is allowing you to provide that service. The state in which you are physically located during the time of the service is allowing you to provide that service. And if your licensing board that you voluntarily asked to regulate you is okay with that, right? So to make it easy, because you might be confused now, to make it easy, if you are providing telemental health services while you are in the state that you're licensed, the client's in the state that you're licensed, that you're licensed and where you are, then there's nothing to it, right? You're fine providing that service as long as you're competent to do so. Now, if the client is in a state where you are not licensed, then most likely you cannot legally provide that service unless you go and seek approval from that licensing board in that state. So I can't get into super in depth into this for sake of time, but understanding and knowing the legalities of that is important. Now, some of you might be thinking, well, what about COVID-19? Because you heard the federal administration saying that states ought to loosen up their licensure law in respect of allowing outside clinicians to practice in their state during this time of crisis. Well, the federal government can say that, but the states still are gonna have their own stance on that. So when you hear about these changes with regulations around COVID-19, you want to be careful. You have what the federal administration wants to happen. Then you do have some federal regulations, such as the federal government manages Medicare, okay? So the federal government can say Medicare is loosening up some restrictions, such as Medicare usually requires that the client is at a site, an originating site that qualifies for the service, which is quite restrictive normally. But during this crisis of COVID-19, they've loosened that up and allowing the client to be at their home location. But that only has to do with reimbursement through Medicare. And of course, you'd have to be an approved provider and all those other things still come into play. So you have the federal government. Another thing about the federal government in COVID-19 is HIPAA. So the Department of Health and Human Services is the agency that regulates HIPAA law, and the Office of Civil Rights is the enforcer. So for this COVID-19 time period, the Office of Civil Rights says that they will not penalize people for using technology to connect with their patients and clients that does not allow them to be HIPAA compliant just during this time period. But you still have state privacy laws. You still have your code of ethics. You still have your licensure law. So you have to be really careful to understand what's going on with these things and not jump to conclusions just because one government, one party saying one thing. Okay, so that's the legalities. Now, in terms of ethics, again, the standard of care and all of your ethical guidelines are still at play when you're providing telemental health, just like they are when a client's in the same room as you. You still have to do all those same things, right? You still have to give someone a adequate informed consent. You still have to verify their identity. You still have to, screen for fit. You still have to have an emergency management plan. You still ought to be able to respond to a crisis remotely, right? Because clients are only in our office for a very short period of time of their life. So they're much more likely to have a crisis outside the session time when they're going to need your assistance. So, all of these things kind of are still in place. But there are some things, that are a little bit different. So with the informed consent, there's some things that we'd have to add to the informed consent, right? So one is the expectations. So on your informed consent, you probably already have expectations of the client. Like you might not want them to come in with a firearm. You might not want them to come in when they're intoxicated or under the influence of drugs. You might not want them to record the session. You might not want them to bring in a visitor into the session without letting you know first. So you might have like certain, expectations, right? So you want to let them know, well, what are the expectations when they're receiving services virtually? And a lot of them are the same. You would say, they ought to come to the session dressed the way that they would if they were coming to your office, right? They ought to be in a private location. They shouldn't have other people in the room with them unless they discuss it with you first time. Shouldn't record the session. They shouldn't be driving. So a lot of these things are common sense, but If you've been doing telemental health for a while, you know this already. It's happened to you. If you haven't, you'll find out that a lot of people will be much more lax when they're receiving services on their own kind of terms, their own space, such as driving, not being fully dressed, not being in a private location. All these kind of things happen, right? So having it in the informed consent really helps you. You should also let them know what's the best way to contact you, what would be your response time. And in regards to contact, we should ask them, and again, this is something you ought to have in your informed consent anyway, but we ought to have a communication consent. And you could have that as part of your informed consent, like what number can you call them on? Can you leave a voicemail? Can you send them mail to an address, right? So that you have their authorization, so that you're not kind of imposing or violating their privacy. You wouldn't want to be calling them if they're in an abusive relationship and their abuser's right there, or they're in a meeting with their boss and they didn't want you calling that phone that they carry around with them at work, or leaving a voicemail at a certain number, those kind of things. You should also let them know what to do if there's a technology failure. So the clients and the clinicians might really respond heavily, I guess. They might feel very anxious, they might feel guilty, they might feel angry, they might feel abandoned when there's technology failures. So it should be clear to them as to what are the appropriate ways to respond to those things. And in terms of creating a safe and private and secure location on their site, that's also important. So one thing's about having sessions, say at their home or at work, or in their car in a parking lot, is that could certainly be interrupted. Now, if you think about it, like a clinician's going, hopefully, a clinician's going to set up their home office in a way where it's going to be very hard for someone to just barge in on their session. Like myself, the way I have my home office set up is I have a double door system, not for like contamination, but I have a door that you'd have to go through that's locked, and then you have to go through another door to get into my office. So it kind of keeps my kids and other people out of my office. If you were in an office setting, you would have a sign on your door letting people know that you're in session, so people aren't knocking on your door, talking loudly in the hallway. So with your client, they might be interrupted during their session, and they might not want that person to know that they're receiving services. So you would let the person know. If someone interrupts your session, just acknowledge the person, and I'll know that someone barged into your session. I'll just disconnect for you, and we can reconnect, reschedule, something like that. Or you could create another system for that. Another piece is the verification of identity. So if the typical way, first of all, a lot of clinicians don't even verify identity, right? But if they do, the typical way they do it is by looking at a picture ID. So there's three ways that you can verify someone's identity. It's who they are, and what they have. So the picture ID is what they have, right? So with video conferencing, they could just hold up, right? They could just hold up their picture ID to the camera and you can see it. Now, if you don't have video, then you'd use I use an identity question. So you'd say, what's your favorite ice cream, right? In the intake. And then you would have that in their chart, what their favorite ice cream is, right? So if you're not sure if it's them, you just ask that identity question. I'm going to move things. Well, we actually have time. I thought the time was different. So that's verification of identity. And you want to verify identity for quite a lot of reasons, actually. So it's a contract, right? It's an agreement between you and the client when you have them sign your consent form. And then it's also HIPAA law requires it because of insurance fraud, and you don't want the wrong medical information going on someone else's medical record or them using someone else's insurance. Collections, if you're having a billing person bill someone, you want to go on the right person. Age of consent to treatment. You want to, if you had to, duty to warn, duty to protect. If you had to call emergency services. There's quite a few reasons why you'd want to verify identity. There could be a dual relationship that you're not aware of without seeing the name. And then you want to verify location. So why would you want to do that? Think about that for a minute. Why do you have to know where the client is? Does it even matter? So some of the reasons are you want to make sure that you're authorized to practice in that area, right? You want to make sure that it's a private, safe, and secure location. And then if you have to get them emergency services, you want to know how to do that. Yeah, so you also want to let them know how the session is going to take place. You want to help them prepare adequately. So these are things that are going to go on the informed consent. Another piece of this is, well, what technology do I use, Ray? Right? A lot of people ask that. What technology to use? Most people are doing video conferencing because insurance often reimburses for video conferencing sessions and not for phone sessions. Phone sessions have happened for a long time, okay? Phone sessions work very, very well. People love it. But video is typically what people do because it's the closest to a client being in your office. And again, because of insurance reimbursement. So for video conferencing, there's several things you want to consider. One is quality. You want it to be a very good quality experience. It's really frustrating to use poor quality. It's not a good user experience. It's going to turn people off. So you want the video to be really crisp, the sound to sound really good. And the way to use that is to choose a program that provides that kind of quality. Another thing is security and privacy. That is not so easy. There's so much differences between video conferencing platforms. So HIPAA law, if you're a covered entity under HIPAA and you're using video conferencing, you have to get a business associate agreement from the vendor that you're using. Another term for video conferencing program is the video client. So the business associate agreement is from the vendor to you, where they are voluntarily subjecting themselves to HIPAA law. And it seems like they would have to abide by HIPAA anyway, because they are legally defined as a business associate. But providing that agreement, they have to follow HIPAA law just like a covered entity under HIPAA does, just like you as a healthcare provider. They have to notify you if there's any breaches of your client's information. They take liability if there's any breaches of your client's information that happened on their end. So it's very important. It's not an easy job to be HIPAA compliant. So they really are taking on a big task and a lot of responsibility and liability when they provide that business associate agreement. But it's not good enough just to get a BAA. So you'll hear from companies that will say, well, this is a HIPAA compliant technology. Doesn't make sense, right? Covered entities and business associates have to be HIPAA compliant. Technology is not fined, right? An entity's fined for non-compliance with HIPAA. Or they'll say, our platform's HIPAA compliant, or here's the BAA, it's all good. No, you still have to do your due diligence to see whether or not the vendor actually is being HIPAA compliant. And you also have to conduct a risk analysis of using the technology for healthcare. So there are so many risks to these things, I can't go through all of them all. But one thing you want to think of is, where is your patient data? Who has access to it? Should they have access to it? Are there any vulnerabilities to that data that's being stored? Okay, so that's one thing. When you're doing video, is there any possibility that someone else, an unintended person, can all of a sudden pop into the meeting? That would be really bad, wouldn't it? That would really freak out your client and would be bad for them and bad for business. So when you go to a video meeting like you are on today on the webinar, it's simply a URL address. If you provided that URL address to your neighbor, they'd be able to get on the same webinar just like you are, right? So you want to make sure someone can't just hop into the session. And you want to really try every scenario possible to try to break into a session to see what those vulnerabilities are. And then you want to have protocol and procedures to eliminate or reduce the risk of that ever happening. And then also you have to retain patient data. So say you're sending chat messages back and forth when you're on video. You have to make sure that you don't lose that data, that you protect the data and you don't lose it, that you have access to it because it's part of the medical chart, right? It's protected health information. So you want to look at what are the risks to losing that information. You also want to make sure that the technology is easy to use, easier than easy to use. You want to try it out with someone that really struggles with technology. So you want it to be secure. You want to be able to be HIPAA compliant when using it. You want it to be super easy to use, and you want it to be very good quality, right? So those are the things to look for. Another thing is reputation. Is this company that's providing it going to be sustainable? Are they reliable? Are they trustworthy? Do they have the resources available? So that's how you make those decisions. Now, there's a lot more to it than that. You want to look at what are the requirements, what are you needing as an organization? Are there other people in your organization that also need to use the technology or would benefit from it, and what would they need? So first you want to figure that out when looking at technology, because when communicating electronically, you're not just looking at video conferencing, you might also be looking at a practice management program, an EHR, phone systems, voicemail, faxing, secure messaging, all these kind of things. So using a platform that provides all of those things and in the correct way with high quality would be the way to go. Some of your staff might need reporting for, say, grants or for reimbursement or for tracking, whatever it is. So you want to consider all the needs, and often, this might sound overwhelming, but often just using a consultant to help you make those decisions will save you a whole lot of time and headache. Especially if this isn't what you do, if you're not a techie and a techie related to healthcare, right? So, a consultant, again, will help you, overcome a lot of those challenges. So I'm going to move on to emergency management planning. You probably learned that when a client is sitting in the same room as you ought to have a plan as to how to respond if they become aggressive, violent, destructive, suicidal, homicidal, have a medical emergency. If there's any of these kind of emergencies, if they're like intoxicated and they can't really care for themselves when they leave your office, what do you do in those situations? Well, you might, and you probably have gotten calls or messages from a client when they're not in your session and they're having some sort of crisis. So being ready to respond to those emergencies is very important. So we ought to have an emergency management plan for, every client and situation. So at a minimum, in order to be able to get a client emergency services during a session, like if we were in session right now with one another through video, I would need to know, who are you? Okay, where are you? Some of these things sound obvious, but there's a lot of platforms that we used to say, oh, the client can remain anonymous, right? Well, there's benefits to that, but there's certainly drawbacks. So you have to know, who are they? Where are they? What's a backup way of getting in touch with them? Emergency contact person, and the 10-digit phone number for police dispatch in their region. Because if you call 911, you're going to get your public safety answering point, and it's going to be very hard for them to transfer you to the correct dispatch. And you're taking up their time from what they're supposed to be doing, which is responding to emergencies, locally. So we have to have that. And you ought to come up with your emergency management plan for low-risk clients and high-risk clients, and talk it through with a colleague, like a peer supervision group, and then test it out and have that procedure in writing, right? And then if you have an emergency, what's the follow-up gonna be? So it's not rocket science, it's actually pretty easy, but it's good to be prepared. Much better to be prepared with those things. Now, in terms of setting up your environment, your personal environment, right? And in regards to doing video, having a really plain background is good. Having a good camera, having a good microphone, good tech, right? Good devices, good internet speed, having backup plans in case you do lose internet, or you do lose power, or you do lose audio, or the vendor, the video conferencing system that you're using doesn't work that day. Having backup plans is also very helpful. Now, of course, some things are going to go wrong that you're not going to have a solution to, and that's fine. But your environment should also be very private. So if people hear, if your client that's on a call with you hears other people in the background, that's going to be really concerning to them. They're going to wonder, is this a private place, right? You should show them your environment and they should show you yours, right? So like you are, you're in an office with just me, no one else. There's my outdoors, right? My backyard. So it's just us, right? And they should show you their environment, right? So you can ensure that there's no one else in the space, right? So you want to make them comfortable with your space, and you want to eliminate all distractions. Okay, it can be very tempting to do other things while you're in session with your client because you might think, oh, they can't see me, they can't see what I'm doing. So maybe I'll respond to email or fill out that bill or something that I have laying on my table. You might get notifications popping up on your screen or the fax machine going off or your phone or things like that. So you want to create a very respectful, conducive environment for therapy and set rules for yourself. Absolutely nothing on your desk, nothing on the screen other than this session that you're having with the client. That's very, very important to uphold the professionalism and to walk the client through these things. Another thing is actually doing video, the skills of video. You want to be looking towards the camera. You could look towards the camera so it looks like you're looking at them, but also be looking at their image on the screen. Okay, you want your eyes at the same height as the client, as the camera. You don't want to be like this, looking down at the client. Now, did you do your homework? Or looking up at the client, right? You want it to be at eye level, meaning the camera and your eyes are at the same height off the floor. You want good lighting on your face so your face isn't darkened out. So all these things are important, and you want to be prepared in terms of how to respond to technology issues themselves. Another thing that's important is to prepare the client for the session. You want the client to come to a video session like, hey, that was easy. That was great. Much better than I thought it would be, right? Like, I love this. Why didn't I do this earlier? You don't want them to be like, oh man, how do I do that? Oh, they're probably waiting for me. It's my fault. You don't want them stressed out and anxious and getting really frustrated with things. So you want to prepare them, and there's ways to do that. Having instructions written out on your website, a video demo, which is great for marketing too, walking them through it over the phone. So making sure that they are, adequately prepared. Now, some of the most common mistakes that I find clinicians make is they assume that because they use certain technology in their personal life every day, that they're competent in using that technology for healthcare. That often is not the case. If you use technology that was designed for healthcare, like it says, hey, this is for healthcare, it's designed for healthcare, maintained for healthcare, right? Configured for healthcare, great. But when you start using technology that was not designed for healthcare, you really run a lot of risks. So a lot of clinicians think, well, I use a voicemail app every day. It works fine. I love it. It's convenient. I use a internet phone system. I use email and texting and social media, and or I use FaceTime or Skype or Google Hangouts. These technology that isn't designed and set up in a way for healthcare, that they run a lot of risks, right? Or I use my mobile phone for personal use all the time. I could use it for work. Now, it's possible to use a lot of these things for healthcare, but it takes configuring and know-how and a due diligence to understand how to do that appropriately, right? And some of the technology you just shouldn't be using for healthcare. It's not secure. It's not set up that way. It's not the purpose of the technology. So that's one thing. Another thing is clinicians were getting listed as providers through a lot of these online companies. They would list providers and you could get counseling through them, pay a certain fee. And so counselors are like, hey, these companies know what they're doing. They're big companies. They're bringing in a lot of money. They bring in a lot of clients for me. I'm sure they know what they're doing. So I'll be listed as a provider. when in fact, the clinician's not able to legally or ethically practice by being listed as a provider for that organization. So it's very important that that clinicians don't just assume that a company's taking care of the legal and ethical obligations for healthcare because they're marketing themselves as providing healthcare services. So what's important is to practice within the boundaries of your competence, just like you did, with providing services on site. So to do that, it's receiving training. Doesn't take long at all, right? So like we have a THTC program. It's a telemental health training certificate program, and I will show that to you. So you're probably looking at my screen. So under the THT certificate program, and you can find other programs out there like this, but you want to take a program that covers the essential aspects of telemental health, that it goes over these things, the legal, ethical considerations, HIPAA considerations, emergency management planning, screening for fit, the clinical skills. So again, these trainings don't take long. You already know, a lot of the basics just being trained as a clinician, but it's important to know how to do these things correctly so that you're ready. So hopefully that was helpful for you. Let me show you one other thing. So AMCA is actually sponsoring this event. We have a Telemental Health Preparedness Summit coming up, and it's May 18th to the 20th. And it's a 3-day virtual conference. It's going to be really neat. The 18th is a pre-conference, 19th and 20th is the conference. There's so many benefits to it being virtual. It's going to be very engaging, a lot of good learning, a lot of interaction and connecting with others and getting support. We actually have support, self-care stuff built in at the end of each day, which I'm really excited about, because this has been a difficult experience, responding to COVID-19 for everybody. You're going to learn about crisis response and the technology piece, both of those. So glad you can make it, and I am looking forward to questions that you have.
All right, so what I'm going to do, I'm kind of grouping these together kind of in like categories here. The first couple of questions I'm gonna bring to you are kind of in regards to your environment, since that's kind of one of the more recent topics that you were talking about. So in terms of like when you were saying, kind of showing the camera, like turning the camera around, kind of two parts to that. What if they're embarrassed to show you their environment, like if it's too messy or something like that? And could you also comment on the violation of the counselor's privacy when working from home during COVID? Because, what if counselors don't want the clients to see the whole room just to prove that no one's there? Ray, I think you're muted. So we didn't hear you after I asked the question, sorry.
I was, thank you. I'm just gonna leave myself unmuted. Yes, so yeah, the COVID-19 time period does change things because the clinician might not be set up for that, but it is important, and the clinician, most cases should be able to set up an environment where they can show the client their space. I think it's important because clients are coming to you. You're not sharing your personal information, right? You're just helping them. They're sharing their story with you, which is very significant. So I think showing our space is really helpful to the client. So I think trying to set it up that I don't think it would take that much time. My daughter likes to rearrange her room every day. But I understand some people do have restrictions with that, but I would certainly make it a priority. In terms of the client showing their space, that's a clinical decision for you to make. But we do have a responsibility to ensure that it is a private, secure, and safe environment. That is important. So I would be careful to kind of let go of these ethical obligations because of a client's being uncomfortable with it. So yeah, it's a clinical decision for the clinician to make, but I think it is important to really look at that. And if a client's resistant to doing so, then you as a clinician need to assess whether or not that's justifiable when you're talking to the client.
Perfect. Let's see. Do you have any platforms that you recommend for telemental health?
I do, but so any platform that I, would recommend still requires you conducting a risk analysis and configuring it and using it appropriately. It's pretty much impossible just to take a technology and use it out of the box, as they say, but one way to make it much easier for you is to use a practice management program that has video conferencing built into it. That's one way to go, because one of the risks is, what if someone else is able to access that meeting? Practice management programs ought to have it set up in a way where an outsider cannot get into the meeting. And not only that, even if they have the meeting link, they can't get in. But not only that, only the client can get access to the meeting link. So it's kind of like a two lock system that you're used to in your office. You have a locked door. Oops, yeah, where's my camera? A locked door, and you also have a locked cabinet, right? It's kind of that, right? Only they can get the link, and then also even if someone did get the link, they still can't get into the meeting. They should have it set up that way. And the way the client accesses the meeting is through a client portal. So that's a really great way to go. If you're not going to go that way, then using a platform that has what's called a waiting room that's configured appropriately. So one that works well is Doxy.me that a lot of people are using. It's very easy to use. The quality varies according to the license that you get with them. The more you pay, I think the better quality you get. But it's a very easy waiting room to use. The way a waiting room works is your client simply is giving your waiting room link. Anyone can get your waiting room link, and they will show up to your waiting room, and you'll see them waiting there, and you can admit them into your meeting. If anyone else shows up, they're just sitting there, but they're not admitted into the meeting. So that's also a very easy way to go. Other platforms make it more complicated to do it in a secure and private way, but there are other platforms that are fantastic, like Zoom and VC. Those are well-known, well-established platforms that work really well. Google Hangouts Meet using a G Suite account. But again, how they're going to get that meeting link is very important. You don't want to send it through an unsecure means like email or something like that. And if you do, you have to go through a certain process for that. So hopefully that helps. Practice management program or a waiting room that works appropriately.
Can you speak to whether or not, so like Zoom has the extra add-on for HIPAA compliant platform. Can you speak to whether or not that you feel like that's necessary in protecting the counselor, or if there are ways, or if, like you said, there are better ways to use a regular Zoom account?
Well, if you're going to use Zoom, definitely use it with the business associate agreement from Zoom, and they make you pay for 10 licenses in order to get that. So it's expensive for an individual. But yeah, you definitely want to use Zoom with the business associate agreement. There are companies that integrated Zoom with their platforms. There was a company, or still is, I think it's still called Regroup Therapy, that integrates with Zoom. Adaptive Telehealth is a practice management program that integrates with Zoom, and there's others. But in terms of using Zoom, yeah, you would certainly want to get the business associate agreement. Even if you're not a covered entity under HIPAA, which would require that you get the BAA from them, you'd still want to use their BAA account because it's actually configured much differently behind the scenes. They don't hold on to data. They encrypt it point to point. So yeah, it is done differently. But you can't just, again, use Zoom out of the box. If you were to chat during a session with a client using Zoom, Zoom is not going to hold on to that chat for you. You would have to save that locally. With Zoom, you'd want to use the password protection on your meetings or lock the meeting as soon as your client enters the waiting room. and then you would want to exit that meeting and enter a brand new meeting for the new client. So there's procedures you would want to take in consideration when using Zoom.
Perfect. Do you have, or does someone else have, an online assessment that would walk a counselor through kind of the critical areas for compliance? Just kind of thinking of something that would let them know if what they're doing is wrong and they might not even realize it, or things, areas where things need to be shored up.
Yeah, so on our site, we do have a telemental health provider workbook. So that provides, it provides a step-by-step guide to setting up telemental health services. It also provides sample clinical forms and sample policies and procedures for telemental health. But that's going to be very helpful because like this step-by-step guide, it'll walk you through step-by-step how it is that you're supposed to set things up, how you're supposed to do your initial session, your follow-up sessions. So that's the whole purpose, is to kind of ensure that you're not going to miss anything with that. So that's a guide that I'm aware of. I do see recently a lot of people putting out posts like on social media and stuff of like a basic guide of things to ensure, using the things we went through, making sure you're practicing legally and ethically, emergency management plan, verifying identity and location, those kind of things we went over today. So I do see people putting out that. We'll probably put one of those on our website also, kind of a step-by-step process. Yeah, and in terms of the client, this is pertaining to that. In terms of the client being prepared for the session, another thing to consider is providing your client a guide, right? So you're looking for a guide, but give your client a guide too. So we actually provide that on our site, on our blog page. It's called, let me see, video meeting. So yeah, on our blog, we actually wrote this up. It goes through step by step how the client ought to prepare for the session, right? So you can just provide them a link to this, or you can write up something very similar for your clients.
Perfect. So getting over to kind of like location for your client or patient, how do you typically verify their location? And what if you have a client who's typically a resident of the state where you're practicing, but they're currently on a trip either to another state or a foreign country? How do you handle that?
Yeah, so legally what matters is where is the client physically during the time of the service, right? Not where they say live most often or have their driver's license from. It's where they are during the time of the service. And there's case law to back that up in terms of like, if you can go to another state and receive a medical procedure from someone who's licensed in that state, but that licensed professional can't travel and come to you, to your state, and provide that procedure to you, right? So it's the location of the client during the time of the session is what's important there. And then, how to verify, where they actually are. You just ask them. That's it. I know it sounds like you should be doing something else, but yeah, you just ask them, what is the address of where you are currently? But you want to know that before the session begins. So you ask them, where are you going to be during the time of your session? And you want to, vet out whether or not it's going to be a private, secure, and safe location. And you also tell them before you even start providing services. You say, you always have to be within the state of, right? Because that's where I'm authorized to practice. So yeah, you just ask them.
Perfect. And to that point, one other question that we had was, could you repeat what you were saying earlier about with your backup plan, having the 10-digit number for emergencies, and how you would find that information and, those kinds of things?
Yeah, the easiest way to find it is search for it on a search engine like Google, and I would just put in police emergency number and put in the street and the zip code, and it'll pop up. on like a Google search, and Google will even put it on a map, So that's how you'll get that 10-digit emergency dispatch number for that area. That's the easiest and quickest way. Some states have actually put out lists so you can easily search within that state what that local dispatch number is.
Perfect. It looks like we are running out of time, so I just have two more questions for you.
Okay.
One, is it ethical to refuse providing services to a client when they're not able to provide an emergency contact before starting a telemental health session? Thinking about this from a risk management perspective, if the clinician is not able to intervene appropriately during a crisis.
Other ethics professionals might have a different opinion than I do. So you might want to ask, if you're regulated by a particular code of ethics, you might want to ask the ethics board or your licensing board. But Ray Barrett's opinion on that, in terms of ethics, so I have an opinion based upon ethics, and then an opinion based upon experience. First of all, let's think about what is an emergency contact for. That's going to help answer that question. So, first you want to determine whether or not an emergency contact person is actually necessary. A lot of your clients do not have to be ill, right? They don't have to be at risk at all. A lot of your clients could be the healthiest people. They could be healthier than you, but they want counseling because counseling is very helpful for healthy people, right? There's no need for an emergency contact person. Now, even if they do have issues and there are risks to seeing this client, is the emergency contact person actually even helpful? A lot of times the emergency contact person can actually be your worst nightmare if you get them involved in the situation. Some people just don't even have someone that's actually going to be helpful in an emergency. It would only make things worse. And would it be ethical to turn them away? Probably not, in my opinion. So one thing I would assess is, what's the purpose of the emergency contact person? Because that's the standard, right? The standard is yes. Standard is yes, have the emergency contact person in case something happens. Where'd my client go? Like, I'm really worried about them, and whatever it is, if you really think that you need to reach out to that person for support or whatever it is. So that's the standard. But I think there is lenience in regards to that. So yeah, those are the things I would consider, in a nutshell.
And the last question, because I seem to be getting a lot of this question, right here at the end. If you have a new client or existing clients that have new paperwork, how do you have them sign those digitally if you're not meeting face to face?
Okay, the best way to run a telemental health practice is to use a practice management program, in my opinion, because everything's done on that one platform. So you do your registration, your intake, communicate with the client, your billing, your reports, your progress notes, your video conferencing, your secure messaging, like everything you could think of is done right there on that one website that you securely access. So they would just simply go to they would go to the client portal and register it themselves online. That's what I'd recommend doing. If you can't do that, there's other ways to do it. You can use, if you have a G Suite account with the business associate agreement, you could use Google Forms. You'd want to do that right. You'd want to have a way to authenticate that they are the ones that filled out the form. And you would also want to save the form in a way where it can't be moderated or changed. And then you could also put PDFs on, say, a website of yours, where they would download the PDF and then they would have to get it to you securely, like either faxing it to you or mailing it to you or uploading it to a practice management program. Yeah, so those are some ways. And there's also communication technology that allows you to send forms. Like someone mentioned Zoom, right? Everyone's using Zoom now, right? So with Zoom, you can actually send a document right through the chat function. Yeah, so those are some ways to do that.
Perfect. If you have time for one more quick question, real quick. Now that children are home from school, is it appropriate to ask them to have their children leave the room or to reschedule when the kids are in another room, just since that's kind of a hot topic right now.
Right. I would definitely have that as the default. So again, what I would do is think through clinically, why would we have the kids leave? What are the risks to the kids not leaving the room? What are those possibilities? So I would think through that, and then so that is definitely the default. And then if you have a particular situation where you think it's reasonable for the child to be in the room, I would recommend getting a consultation on that. But think through it ahead of time. Like you might want to tell the client, I'm going to have to consider that and get some consultation on that, and then make a clinical decision on that. Because there certainly are risks to that, not just for the client, but also the client's children. The other people in the room, there's risks. There's several risks to that. And a lot of those risks are you can't foresee. Now, when asking that question, when asking any question about telemental health, I think it's really important to ask the same question if the client came into your office. So are you okay with that client coming to your office and having their kids in your office during the session? Because it's the exact same situation. And sometimes it is okay, right? And most times it's not, but sometimes it is. So I would put it that way.
That's a really great way to think about it. Thank you so much, Ray.
Yeah.
Thank you to everyone for attending today's webinar, Telemental Health Best Practices Overview. If you have any other questions, please contact AMCA at education@amca.org. Once you leave today's webinar, you'll receive a survey for this presentation, and we would appreciate it if you would complete that and provide your feedback. Don't forget to look for your follow-up email within the next few days with the recording of today's event, a link to the presentation, and your CE certificate if you attended for at least 45 minutes required by NBCC. Have a great afternoon.